It's a serious problem that's expected to get worse. There's a shortage of primary care doctors across the state and the country. Now there's a new program aimed at getting med students to stick with primary care. NBC Connecticut's Debra Bogstie takes a closer look.
Cover your own words. What's going on?
Dr. Douglas Gerard runs an internal medicine practice in New Hartford, and he's the only physician in town. Patients who get sick, like Mike DiMartino, can still get in the same day they call.
I don't know where you would go and what you would do if you didn't have that accessibility.
But with a shortage of primary care doctors, same-day sick visits are not always an option at other practices. It's a problem that's expected to grow by 2015, when at least 30 million people land health insurance under government reform.
You need to leave openings every day for people to call up and want to be seen. It's not fair to tell a patient who's been seeing me for 25 years, calls in with a sore throat saying, no, I can't see you for 2 weeks.
In Litchfield County alone, at least 4 primary care doctors have recently closed up. Dr. Gerard, who's also the president of the Litchfield County Medical Association, is so busy he's forced to turn most new patients away.
A patient established with us waits a year now to get their next annual exam.
A 2009 Connecticut State Medical Society survey found 28% of internists, 26% of family physicians, and 16% of pediatricians are not accepting new patients. And almost 25% of primary care physicians surveyed say they may move out of state in the next 5 years. To help reverse the shortage, Danbury Hospital just landed $4.5 million in federal grants to launch what it calls an innovative new residency program. It's aimed at increasing the number of physicians who actually go into primary care rather than becoming hospitalists or specialists.
There is nothing worse than having an insurance that covers you and yet not having a physician.
Dr. Ramin Ahmadi developed Danbury Hospital's program. He says residents who often have steep debt from student loans avoid primary care because of lower reimbursement rates, lower salaries, and because training programs are primarily done in hospitals rather than private practices.
These graduates don't feel comfortable practicing outside the hospital setting. That's not where most of their training has been.
Under this program, the docs in training will spend more time outside the hospital, including 7 months in a single practice during their final year. Dr. Jason Gajraj is in his first year in the program and plans to follow his father's footsteps, practicing primary care.
I've been around it a long time, and I understand the needs of patients and the necessity to be able to be accessible and to communicate well.
A shortage of primary care doctors, a problem that's leaving physicians overwhelmed and patients without the care they need.
We've known for years that this day is coming. They're just starting enough primary care guys to go around.
Debra Bogstie, NBC Connecticut News.